Okay, so I'm getting ready for a photo session here. I have to adjust the lights because I kind of messed them up. Now I'm real anal retentive about where these lights are positioned because they have to be exactly in the same spot every single time I take them. So let's go ahead and line these lights up here. Just like that. I got them on the corners so that I always have consistent shots when I'm taking my photos. So do this, make sure that it's lined up. And these I want at approximately 45 degrees, making a perfect triangle. Okay, so here's my setup. Now on this chair, you can see it's just a dental assisting chair. If you can find one without a back, that's even better. I got these lined up here on the back side, centered. And for the weapon of the day, we have the Sony a7 III with a 28 to 75 millimeter with an aperture, a constant aperture, meaning that it doesn't change as you zoom in and out, of 2.8. And that's going to be what I'm going to be shooting at. I'm about, with the lights on, depending on how bright the lights are, it's going to determine what your ISO should be, what your not your aperture, what your shutter should be. But I think on these, I'm shooting at a shutter speed of 1/200th of a second. So, okay, and for equipment to use, I'm using just a cage retractors. That's what I call them. I don't know if that's what they're really called, but, and then a contraster, and that's all I'm doing. And I'll show the types of photos as I go explaining the video. All right, so it's time for photo session number 3. This patient was a 70-year-old woman from, I believe, North Ohio. And her complaint was that she had some baby teeth and she was missing her laterals and she just wanted a makeover. So that was Emily. She just gave me the route sheet. I always take a picture of the route sheet because when I upload them later into Lightroom, I need to know who they are. Sometimes I'm doing a couple of these in a row. The first shot that I'm doing is a frontal shot, smiling. You don't have to necessarily do this in the same sequence that I'm doing it. It's just I do it for consistency, and so when I'm always trying to make my photography sessions better, faster, and easier, so that I can teach it to other people. And that's why I like trying to keep the sequence the same. As far as side shots, when I'm doing side smiling shots, I just have them turn their head. I don't have them turn their body. It's just easier for them to turn their head. Now, the reason I do side smiling shots is because when I do before and afters, it's just more content for Instagram, for Facebook, or whatever you want to do. So my shots may not be the same that you're doing. So whenever you find the kind of shots that you want, the hardest thing to do when taking dental photography is the consistency. So my lights are always in the same spot to the inch. The chair is always in the same spot. The lighting is always at the same spot. My settings are always the same. Everything has to be the same, and it has to be consistent across the board. Now, let's see, I'm doing the retraction on her. She had a hard time trying to figure out how those things went in. And I had to show her. It took me a little bit. If you don't have these already, it's a good idea to get these, and I'll put the link in the description below. Also, I'm going to put the link for a photo release if you don't have one already for your practice. It's a legal document that you have to have whenever you're doing, or anytime you're using patients' photos or their teeth, their face, on social media. So it's editable if you want to use it. It's a Word document. It's down below. Now, even though I told her just to move her head, she doesn't always move her head in the same spot every time. Most people do, and I don't have to move my camera, so this patient did. I always tell them to look at 45 degrees at the light, make sure that they close their eyes, because I believe these lights are like 85 watts and they get really, really bright. So, alright, so the next shot is the contrast shot. This is pretty big on Instagram. A lot of people are doing it. So what I'm going to have her do is put the retractors in at 45 degrees as I just showed you there. But what I might do later on down the road is actually just have them normally do the normal retraction like I'm doing a frontal shot, and just put the contraster rested on their jaw. I mean, I rested on their jaw anyway, but then what I'm going to do is basically take their hands and I'm going to move it myself and then tell them to hold it in that position, because that way, not everybody's the same when you do that. So I need to get all the lips out of the shot, off the gums, and this technique has worked the best. I forget who showed me this. I found it on YouTube actually, but it's really great because I don't have to worry about getting one of those forks and lifting their hand and having their hand in the light and blocking the light and all that. So I'm just having her, what a lot of people do when I'm taking this shot is lift their chin. So their whole head is lifted back, so I have to basically instruct them to lower your chin or lower your head. All right, and that's what she did. All right, so I'm done with those. The last shot is the portrait shot, and if I didn't mention it before, all these shots are at 75 millimeters, and that's going to be different for everybody, but I typically say anywhere from 50 to 85 millimeters is where you want to be. If you have a 100 millimeter lens, I think if you're in a room, especially in a operatory, it's hard to get portraits in that setting because you need the rim to back up, because 100 millimeters is really close up and you have to walk all the way back. I take a couple of them because I want to get a good smiling shot, one that shows their true personality and their smile, so that I have contrast at the end. And I believe that's it. So if you have any questions, leave them in the comments section below, and I will talk to you later. Take care. Bye.